All right, we are live and I'm so excited. I'm here with Dr. Richard Baxter from the Alabama Tongue Tie Center. You can see a sign in the background. And we are just having a casual conversation today. There's a lot of stuff going on in the field of tongue tie and myofunctional therapy. And we have both had the honor of taking each other's courses and hearing each other lecture. And I thought, why don't we get together? Let's offer some information for anybody out there who's interested in getting into doing what I do or doing what you do, Dr. Baxter. And let's talk about all the fun stuff we're doing. So before we get started, I'll introduce myself, but why don't you start off, introduce yourself in case anybody doesn't know who you are. I think that would be a little bit crazy in our world. Everyone knows who you are. But give us some background on you, tell us who you are, and then I'll do the same and we'll just go from there.
Yeah, sure. So I'm a pediatric dentist, live in Birmingham, Alabama, or technically in Pelham, Alabama. And so, yeah, my girls about 6 years ago had tongue tie, lip tie issues that I didn't even know about. I wasn't trained in dental school or in pediatric residency for. And actually, a lactation consultant told us your girls have tongue tie. I said, no, they don't. I would know, I'm a dentist, but I was open-minded enough to figure out there's a lot more to this. After being clipped incompletely by our well-meaning pediatrician, who we loved, we went and saw a dentist, Dr. Notstein in Ohio, and he was like one of the early pioneers. He wrote an article in the early 90s, I think 91, about tongue tie. And so he did it for us and it helped a lot more. And then we moved down here not too long after, researching everything I could, as many courses as possible, started providing it, and ended up so many parents were asking. I was going to say, so many parents asked, how is my provider, my dentist, my lactation consultant, speech therapist, pediatrician, whoever, how have they not heard of us before? I said, that's a really good question. So it started just like this almost ranting blog post on my phone. I typed a decent amount on my phone, and then I switched over to the computer and stuff. But yeah, it turned into this book here, and we had 6 other contributors and then a pediatrician write the foreword. Just try to keep it as multidisciplinary as possible to give the latest information, easily digestible format. And then now it's like, hey, it was so hard figuring all this stuff out to start treating these patients. I had a lot of people asking to do a course. And so came up with the Tongue Tied Academy, which is basically the A to Z foundational course. You can take this and hopefully get started. We had the idea before all this online learning stuff. So with COVID now, everything's moved to online. Like I was telling Dr. Zaghi, is that you need an online course. No, we like the live course. It's so much better. I said, I know, but for me, it's hard to travel with kids and with a practice and take off for 3 or 4 days. And so that was the idea with Tongue Tied Academy, which is we could create an online course where people could take it and feel confident and competent to start treating patients. And then certainly you need some more education as well along the way. If you want to do adults, Dr. Zaghi's course, which I just took a couple of months ago, or Sarah's course here, I took that one too a few months ago as well. So yeah, there's just lots of great opportunities now with online learning. And I think you can definitely get enough to get started, and way more than I had when I treated my first patient. So
yeah. And that's what I really liked about taking your course. And I feel like we have such similar stories in that way is 2 things happen. One, you just want information to get out there, and people keep asking you, how do I get training? How do I learn? And that's what happened to me. That's one of the reasons I started my mentoring program, is I had so many professionals asking me, how are you doing this? And, how did you get started? And then 2, you just end up repeating a lot of the same stuff to your patients. And so same thing with your book. That's how my YouTube channel started. I just thought there's got to be a way to get this information out there. I'm just going to start making videos, and I'll send my patients the link to videos. And little did I know that professionals would start doing the same thing with their patients for my YouTube channel. So, but I'll back up and just introduce myself as well. I'm a dental hygienist by training. I started doing myofunctional therapy in 2010, where I was located in Seattle at the time. And for the first 5 years that I practiced, I saw my patients fully in person, in private practice, in an office. And then around 2015, I really transitioned to working completely online. And so a lot of people know me as the online myofunctional therapist, because I've been doing the whole telehealth thing that now we're all learning about through COVID. I've been doing that for the past 5 years. So yeah, you know, things evolve and grow. And I started this mentoring program called MyoMentor that I was super honored when you reached out to me, Dr. Baxter, and said, hey, I want my hygienist to go through your program. And I said, you should do it too, jump on board.
You did. Yep. I took them all.
And so you did. And yeah, I really enjoyed your course too. And the thing that I could tell from your program is that you were really putting out what you wish you had. And that's the same thing I do. I'm like, when I was new and struggling and I didn't know how to start, here's what I wanted. I wanted somebody to hold my hand. I wanted somebody to ask questions. I really wanted a mentor. And so that's why my program is called MyoMentor. I just thought there's got to be an easier way. And why am I here reinventing the wheel? And then every single person who gets started has to reinvent the wheel. And I thought there's got to be a way that if I can figure this out in the future, I'm going to be a mentor to other hygienists who are trying to figure that out. So that's really how my journey started. So,
and at the end of the day, we can help so many more patients that way by multiplying this knowledge in an easily digestible way. I think that's the key. Like, that's why the book was successful. Like, you can pick it up and read it in a few days and like, okay, they have a pretty good grasp on it. But then that's not enough to treat a patient, obviously, just reading a book. So like, you know, like you have like here's the session, here's how I do it. Like, you know, like for us, like with the tongue-tied academy, it's like, here's physically how to do it. Here's what to say to the patient. Here's like, literally I had a camera crew just follow me around the whole day, and we just put that up. Like, it's called virtual shadowing. It's like you're in the office with us, and we treated like eight or nine patients, I think. So
yeah, I love that part. And also, I mean, we've had conversations about this, but the video quality that for your course, it's amazing. It looks so good. So I think that was a really nice touch that you added, getting it all like super professionally filmed. So
yeah, it took them like 8 hours just to get the lighting right. Like, it was crazy. Like, it's like professional. Like, they do documentaries and other online courses and stuff, like advertisements. So it was a very professional like lighting and film crew. I mean, it was impressive. We had
yeah, you can tell it looks good. So I think what we should do today, kind of my thought was, I want each of us to give 3 tips. So your 3 tips will be geared towards dentists who are interested in getting involved in oral restrictions, you know, learning how to check their patients for tongue ties, learning how to do the surgery. If you had 3 pieces of advice to give those patients or those dentists, that's what I want you to cover. I'm going to cover, and we'll go back and forth. I want to talk about 3 tips that I recommend for new hygienists or anybody who's interested in getting involved in becoming a myofunctional therapist. So you want to start it off with your first tip?
Sure. I think learn as much as possible. Like, just everyone's on a different journey. And so like, start with something like a blog post or watching some of Sarah's YouTube videos. Pick up a book or some journal articles. We just had another article come out a couple weeks ago. There was the first one talking about like solid feeding and tongue ties, the speech, feeding, and sleep issues. And it's on our website. We have it for free if you want to download the full text. But just like read as much as possible. That's the biggest key.
For free. You can do a lot for free.
There's a lot of stuff for free. We're actually giving the book away for free now too. Haven't quite gotten there yet, but we're going to start doing that.
That's
to
amazing.
Professionals. Yeah. So patients still buy it. And if you want a hardcover, still buy it. But like, we're going to give away the Kindle version you can read on your iPad, PDF, for totally free. And so
I love that.
Yeah, it'll be on our Tongue Tied Academy page, probably, something like that.
So cool.
But it's for patients as much as it is like, we just want to get this knowledge. Can you hear me? Yeah. We just want to get this knowledge out there to professionals, because the more knowledge people have, the more you're going to like, oh my gosh, like, you can see it in your patients. That's a good tip 2 though. So yes, learn as much as possible. That's tip 1.
Okay, tip number 1, learn as much as possible, and realize, I'm going to add to your tip, realize there's a lot of really good free content out there. So
yeah.
All right. My tip number 1, I always say this in my courses, do not let perfectionism prevent you from taking action. So all of us hygienists and dentists tend to be really type A. We're perfectionists. And I think if you're not careful, it's a good thing, right? But if you're not careful, it will hold you back. So I see this every day with the students that I teach. They want to be 100% perfect before they get started and see their first patient. And I have to say, and I bet Dr. Baxter would agree with me, that's impossible. You're not going to be a perfect expert on your very first patient. And we all have to think back to our original, think about the first day you were in dental school, the first day you were in dental hygiene clinic. You don't know everything. You can only learn it with experience. So you just have to get out there and try and fail and feel like a dummy talking about it in front of patients, but that's the only way you'll actually get better. So do not let perfectionism prevent you from taking action. Would you agree with that one?
Yeah, no, for sure. And I was getting my second tip too. Like same thing. I just start checking people. Like just get your hands dirty. We'll start checking your patients. So if you're a dentist watching this, like once you know what a tongue tie looks like, you'll be shocked at how many of your patients just on regular hygiene checks. So something you're already doing, checking hygiene. Like, oh my gosh, like Mrs. Jones, this is to the tip. Like any issues with like neck tension, shoulder pain, headaches, migraines, sleep issues, like do you have trouble swallowing pills? I mean, there's so much overlap here. Sarah's laughing because like myofunctional therapy and like tongue tie, it's like, two sides of the same coin. But all these things a lot of them are like myofunctional issues, but they also often have a tongue tie that's leading to those. And so if there's no string there, obviously like try therapy first and see how it goes. But if it's like to the tip, like no amount of therapy is going to overcome that. You got to release it. But with the coordinated team approach and with doing like a therapy program, we'll get the best results. I know personally, because I've had my tongue tied done a few times, the first couple of times with no good myofunctional therapy. And then the last time I was doing more. And so it did not grow back together. But that's the thing. If you don't do a therapy, you're going to end up treating it again.
I know. And that, I'm so glad you mentioned that, because that's kind of like why we started to do this in the first place, was to talk about how well the surgery and the therapy go together. And I don't know why that's not, I mean, to us, it seems like common sense. Like, of course you would do exercises before and after surgery, but that tongue tie, I think the frenectomy procedure is mostly done, I would say, in mainstream dentistry. It's usually not recommended to do exercises. And I think that's just because people don't know.
No stretching. And like, or the ENT will do it while the kid's asleep. They'll put some sutures in maybe, or they won't, or they'll cut halfway. Nothing against ENTs if they're watching this. Like, we have lots of friends. Dr. Zaghi's ENT, friends of mine. But at the same time, like, we have so many that basically, if you have syndactyly, your fingers stuck together, just clip like that much. Yeah. It's like, what did you really do there? Did you just store function? Like, we get the whole thing apart so that like now you can, but now you got to relearn. Or like if your arms, rubber band to your side, like I can throw a ball. Like, no, you got to like cut that string. Now I can throw a ball. So you have to have therapy. If you have knee surgery, if you have any kind of surgery, you do PT with it. But
I love that analogy. That was so good. I've never seen anybody do that finger analogy. That's perfect.
Yeah. I don't know. It's like a Star Wars kind of thing. Right? But yeah, syndactyly. We had a patient with syndactyly, and they came in. They also had a tongue tie. And I was like, you know what? I can take the laser and like I could get down pretty good. But I was like, but then that's the same thing I say. Like, no, they need like a Zplasty. They need like a plastic surgeon to like fix it right. Versus like, I mean, I could probably get through the thin membrane there, but like once it got down to the bottom of the palm, it was a lot thicker. And so, anyway, I was just that's what people think. Like, oh, go just snip. What's the big deal? And a lot of the ENTs would rather be doing like these cochlear implants, helping people hear for the first time, or these sinus surgeries. Like, that's what gets them excited. For us, like it's a tongue tie, because it's not so simple as just a snip. It's like, well, there's certain ways to do it, and there's an art to it in addition to the science. But
well, it leads me to my second tip, actually. So if you're a new hygienist, myofunctional therapist getting started, I think we have to remember that the point of our therapy, it's not exercises, it's restoring normal function. And you mentioned that, we're trying to get these tongues and oral tissues functioning optimally and correctly. And so when we think about it as just, here's your sheet of exercises, or, oh, we're just doing exercises, that is a little bit, I don't know the word, but it's not quite accurate.
Yeah, it's incomplete.
Yeah, it's incomplete to just say, oh, it's exercises. It's really, we're trying to, I have a YouTube video that has a lot of views. It's the 4 goals of myofunctional therapy. And I always go back to it because it's, the 4 goals would be: number 1, breathe through your nose. Number 2, have your lips resting together. Number 3, have your tongue in your palate. And number 4, swallow functionally and correctly. And those are things we shouldn't need a therapist to teach us. these are things we should do every day in normal functional life, and we shouldn't need anybody to teach us. And so I think if we look at it in terms of these exercises are restoring function of how we all should be, it makes a lot more sense. And it's a lot more than just click your tongue and, you know, stretch your tongue and all of these things. Yeah, exactly. Perfect.
Yeah, like,
you got
the goal of that. Like, you're trying to get jaw-tongue dissociation. That's why you have them. So
I love
like,
it.
so many patients, I can't even do it the wrong way now. You probably kind of, they like to move their jaw and their tongue together. It's like they're yoked together. So you try to get them to move their tongue independently. Like, it's just small stuff like that.
Yeah, and it's just, again, it's restoring how we should be. And I love that concept, because it doesn't have to be, you know, people think, do I need to do this every day for the rest of my life? And I'm like, no, like, once you've got it, you've got it. And that's just how you should be.
Mm-hmm.
So it's not actually that crazy, you know, it's not complicated. So, all right, what would your third tip be?
Just kind of change your paradigm. Like, just like have an open mind, but like things like common is not normal. So like cavities, right? And kids are common, but they're not normal. So like some things like picky eating, like people think that's just common, so it's normal. But like, maybe it is. Maybe it's just a 2-year-old thing, but if they have like trouble with meat and trouble with mashed potatoes, they can't lateralize well, they can't swallow well, or it's like scary to them to swallow, the kids will just spit it out and give it back. Whereas like the parents think, oh, that kid's just being, you know, like ornery, just being difficult. Like, that's just who it is. That's just Connor or whatever. But like, no, there's a reason why he's doing that, probably. And because it's difficult for him to swallow. There's lots of effort if they have a tongue tie. They're just snoring. That's cute, right? Y'all kids, you know, snore, sleep with their mouth open. Like, you know, no, that's a red flag. Something's wrong. So I think that's the biggest thing. Just like having a degree of suspicion about things, like, why is he not talking these 3 yet? Like, that's not normal. No. Sure, like a lot of kids have speech delay, but let's look and see. And like, often you look in there and there's hardly anything there. But if they have like picky eating, and they have the sleep issues, and there's some speech issues, and a history of nursing issues as a baby, have a very high degree of suspicion for that, because very likely it's a posterior tongue tie. I'll see if I can share this slide real fast.
Yeah, go for it. That's a great idea.
Just for fun.
Pictures in there.
Yeah, let me see here. So yeah, the key is examining properly. Yeah, here's like our slides too. Examining properly from behind. So there's a child. You can see right there. Move the screen over. So we use a tooth chair so you don't get bit. That's why a lot of people don't check children, because to check the tongue, you're going to get bit if you don't know what you're doing. And babies, they don't have teeth, but they can still gum you pretty hard. But come from behind. If you try to check the mom's lap and the car seat, you can do this in a dental chair too. But yeah, car seat and mom's lap don't work. But really, what we're trying to communicate is it's a spectrum of restriction. So on the upper left here, there's not much there. That's not a lip tie. Even though it comes down to here. This one's not bad either, but when it starts blanching the tissue, these ones are tight. This one's notching the bone a little bit. This one's notching the bone. It's pulling up so tight. This one's real thick and corded. This is the shortest one I've ever seen. So some are super tight, some are not. So it's kind of variable, but the key is function, right? Like, is it causing a problem for the mom? Is there a poor seal at the breast? These are babies, obviously. Is the milk leaking out? Are they real gassy, swallowing air? So yeah, like they sell gas drops, common but not normal. Passy, not staying in. They sell these Webinub animals that should come with a tongue tie warning on them. Like, your child may have a tongue tie if you bought this product, because the passy won't stay in, right? You know what I'm talking about, Sarah? Those little stuffed animals they put on passies, which are terrible.
I don't think they're good at all. I think that's
it's bad for their oral development and everything else. But like, again, people think like, oh, the passy's going all over the room. Maybe I should get one of these Webinubs. And so anyway.
Thank you for sharing that.
Yeah, here's some tongues too. So the tongues come in all different shapes and sizes. But the crazy thing is, one that's not even virtually there. This is a posterior ties. These are more anterior ties. And this one's been clipped before. You can see how thick that is. Like we were talking before, they just
looks like scar. Yeah.
Real thick. This one I think was clipped also. But the ones that are less obvious often cause more pain to mom. And so it's really unfortunate, because the moms think, like, my child has all the signs of a tongue tie, but everyone the 2 pediatricians I talked to, the 2 ENTs I talked to, the dentist I talked to, they said there's nothing there.
Yeah, they say they're fine.
They're saying there's no to the tip tie. If they saw this, they'd be like, oh yeah, there's something there. But even like one, like this one, medium, or like this big, oh yeah, it's fine. They'll stretch out. So
yeah.
Anyway.
Well, I think that brings us back to something that I've ended up lecturing a lot on with the Breathe Institute is our system for measurement. If we all can understand that it's not just measuring the frenum, which is really what we've been doing forever, it's more about looking at function in the big picture. And it just, the knowledge has to grow, the information has to spread. We've got to be able to, find the colleagues who get this when they look, and they're not just looking at, oh, does the frenum go to the tip of the tongue? They're looking at so much more than that. Or even I think in babies, and you could probably speak to this better than me, oh, they're gaining weight, so it's fine. Their tongue tie doesn't matter. And I think that's the biggest. Mark. Yeah.
You know what I mean? Like here's our infant sheet right here. So can you read those? Or
yeah, looks good.
So weight gain is 1 check mark. Here's all the issues that a baby can have. And that may not all of them, but the most common ones, right? Here's the ones that moms can have. So weight gain and then painful nursing for mom, those are only like 2 of the check marks. So we had a baby last week even that had like 20 check marks, like almost every check mark, but they were gaining weight. Well, mom had a big supply, so she was compensating. Just like kids will compensate too. That's like the goal of myofunctional therapy, like reduce all these compensations that they're having, because they're finding a way to adapt. Like as humans, we're so good at adapting, but there's so many issues that like milk dribbling out, their reflux, colicky, like they're spitting up all the time, but they're still gaining weight. Oh yeah, they're fine. Just leave it.
So while you've got this slide up, I want to say, because this is something I was super impressed by in your Tongue Tied Academy course, is that you literally go through every single one of these and you explain it and you talk about it, and you work through all of the documents that you use and why you ask these questions. And I think it's so helpful for a new dentist or even a new myofunctional therapist to go through and understand what you're asking and why. And so, I that's something I liked about your course.
You have like a light version for therapists that's much less expensive. That doesn't have like how to treat, but has like all the other stuff and all the cases. There's like 60 case studies. But yeah, it's the big domains of speech, feeding, sleep, and other. So the other's more like adult stuff, like neck, shoulder, pain, or tension. Although we'll have 7-year-olds spontaneously just tell us like, I can move my head now. Like, this is crazy. Like totally on their own. TMJ pain, headaches, mouth breathing, constipation even. Like, it's shocking how many kids and even adults have constipation and like don't even realize it could be linked to feeding. Because if they're not chewing their food properly, it doesn't start the journey right, won't end the journey right. There's so many things that go into that. If the swallow is not proper, that swallow, that peristaltic wave that travels your GI system, has to do with it starts in the mouth, right?
Yes, exactly.
That wave starts in the mouth. So if your swallow is not as forceful, like not as good amplitude, then you can't. You're gonna have like decreased GI motility. And the third reason is that fascia. And so when you release it, it relaxes, and you go from fight or flight mode to rest and digest, right? Your body can't be in both. You have to, one predominates, so sympathetic or parasympathetic. So if rest and digest can predominate, then you can go to the bathroom easier. But
exactly. Even just mouth breathing alone, that can lead to constipation because of that whole parasympathetic versus sympathetic state. And if you're mouth breathing, you're more likely to be in that sympathetic mode. And so it's crazy to me, all of these really, I think, important and almost life-changing issues that people can have if they're not even aware they exist, or that that's a problem and it's not normal. Again, maybe it's common, but it's not normal for them. People don't even realize how bad this actually is until they start to learn about this and meet a doctor like you who's going to take them through it, or they meet a myofunctional therapist like me who's going to ask them these questions as well. And I think education is our big thing, which actually that was going to be my third point if you want me to talk about it.
Go ahead. Go.
I think, and maybe I should share my screen as well.
I was going to say this one real fast. Like this child,
go for that.
This child could be normal or could be abnormal. I don't know. Just looking at the picture, or don't diagnose on Facebook.
Totally.
The teeth are turning in, which is a little bit of a sign there that something's pulling on it. When you just look in there like on a hygiene check, not much there. You pull back on it, yeah, this is tight. So then just ask the mom, hey mom, any speech, feeding, or sleep issues? And you'll know the ones that'll bite and ones that don't want to talk about it at all. So I'm like, oh my gosh, yes, he's not sleeping at all. And he's been in speech therapy for 3 years with no progress. And I can't eat anything other than like whatever, Pop-Tarts or something. Like that's all he eats. And so, hey, we should probably do a further evaluation, go through the 50 symptoms versus they're like, nope, he's fine, no problems. Okay, that's fine. See you later.
Yeah.
Wait, no cavities. And so, and other times like they're like, no, he really does do fine. There's no issues. Okay, then just leave it. But hey, if there's become a problem later, or if he needs to be in speech therapy later, then come back and talk to us, because this could be normal, it could be abnormal depending on the function. It's all dependent on the symptoms are more important than the appearance.
Yeah. I love that. We're so aligned in all the things we talk about.
Elevation is more important than protrusion, because you don't need sticking your tongue out for licking an ice cream cone, French kissing, making fun of people. But like for like breathing, sleep, eating, like speech, you need elevation. All right, I'll get off my soapbox. I can go on for days, as I know you can too.
No, that's great. I'm so glad you showed those slides, because I think at least I can speak from my perspective and maybe yours, but when I got out of dental hygiene school, like I only thought a tongue tie was full ankyloglossia, so tip of the tongue anchored to the floor of the mouth. And I only thought even that was an issue if they had speech problems or if they're a baby who couldn't breastfeed. So if they were an adult who spoke fine and who didn't have a lisp or, trouble saying R, but they were fully grade 4, really bad, severe tongue tie, we just said, well, it's not affecting their speech, so it's fine. And that's what we all learned. I think, is that what you learned?
Yeah, sorry. I was in this video too, if I want to show it later. But yeah, it's crazy. It's like, oh yeah, it may cause problem with speech. And like licking an ice cream cone, I think is like what they said.
Yeah, they do.
But if you do the Zplasty procedure and like you have to put the kid to sleep and it's real complicated, don't even think about doing it unless you're an oral surgeon. That was like what we were taught. We had one slide of one lecture, I think in third year of dental school, and it showed the Zplasty technique.
And that's it. Yeah.
And I was like, that looks terrible. I'm never going to do that. I'll stick to fillings and crowns and stuff.
I know. And that's kind of how I felt in hygiene. They talked about if it's causing mucogingival issues, so gum recession issues, then maybe you can release it too.
That's the biggest problem. Like, and that hygiene, like, oh, like, let's have some recession down here. Like, like,
I know, totally.
He can't talk or he can't sleep. And his brain development's impaired, and he has ADD because he has like sleep disorder breathing and like terrible sleep quality.
Yeah.
I get ADD when I don't sleep well. I have poor behavior when I don't sleep well. So these kids that in light stage 1, stage 2 sleep all night, like they don't have a chance.
Yeah, they're not getting restorative sleep. They're not getting that repair and regenerative and even like growth hormones released.
Yeah.
And that's why a lot of these kids they're exhausted. Small. They're small for their age because they're not growing. They're sick all the time because their immune system isn't able to repair, and they're probably mouth breathing. And it's so much bigger than people realize. And I even had a student ask me the other day, well, tongue tie isn't really a health issue. I called it a health concern. And they're like, it's not really a health concern. And I said, to me, it is. It's a big health concern. So
it impacts so much. Like it says in the Bible, like the tongue is the rudder. Like it impacts so many things. Like you're like, yeah, it's in James, I think. So many things it impacts. Like Larry Kotlow, I think it was. Larry Kotlow says the tongue is an organ. And he's so right. Like it's like the heart. The heart's just a muscle. Like it's a collection of muscle cells, and like it just pumps. Like your tongue, like breathing, speech, posture. We didn't talk about that yet. Sleep, feeding. I mean, there's so many things. It's crazy. So if it's held down to the tip, you can't move your tongue at all. Or even if it's like halfway, but you can't get the back of it up, then it's really can impact a lot.
A ton, which brings me to my tip number 3. We got to get back on our tips.
Yeah,
so,
right.
But it all connects, and this is like, it's such an easy conversation. So, so my third tip is if you're looking for training, find organizations and groups who are really trying to grow the field. I think the Breathe Institute is such a good example of this. You are Dr. Baxter. I'm trying my best, but organizations who are involved with the latest research. I know you're putting out research. You know, people who are constantly learning, I think, you know, just like you're talking about taking a ton of courses, I do too. I've taken like almost all the myofunctional therapy courses out there because I want to know what's the latest and greatest, and no pun intended, I want to know the cutting edge, you know, of what's happening in the field. And so the more we collaborate, the more we work together to grow the field, I think the more that's going to get out there into the mainstream. And, you know, if we can get behind research, it can get into the literature, which will help on the, you know, academic side of things, which eventually will get to the medical field and the medical and dental schools. And so we've kind of got to get that double pronged approach. So when you're looking for a course, don't think that there's one course that's like the magic bullet, the only course you'll ever need, the only thing you'll ever need to learn. You just take it once and then you know everything forever. It doesn't work that way. I think it's a journey, and we just have to realize, like, you probably got to take at least a course a year, at least, and keep learning.
And like connecting with people and networking for sure. And I think like your course like is really good for like foundational for like myofunctional therapy. And that's what we were doing for like our hygienists. We had with 3 hygienists, and like, we have 1 myofunctional therapist in the state. So like, telehealth is critical, but one, so Lauren, she contributed to the book. She used to be in our office for a couple of years, and then she got so busy, like she had to hire another therapist to help her. And so she's now training another speech therapist to be a myofunctional therapist. And so they're across the street now, but like they're busy, have a wait list. I mean, there's a huge need for this. And so we were like, hey, we need our hygienists to do this, because like we're trying to get to the point where say no teenagers or adults or even like older kids, unless they have like active myofunctional therapy. Most of them have a speech therapist already that like may have some motor, you know, that some knowledge of tongue tie, but like really it's just traditional speech therapy.
So I'm going to share my screen because in my tongue tie lecture that I give, I'm trying to highlight and spotlight research. And I think there's a couple things that you mentioned that for people who don't speak this and talk about it every day, they might be listening to you or me saying, what do you mean neck issues? What do you mean snoring? How is this connected to tongue tie? Like, what are you guys talking about?
Making that up.
Yeah, we're just making it up. So we actually do have research. We just had, through the Breathe Institute, through Dr. Zplasty, we just published a article or paper connecting tongue tie and frenectomy and myofunctional therapy with improvement in several areas. So I'm going to bring up a table from my lecture and just show you guys. And Dr. Baxter, I know you're putting together some research too, if you want to talk about that as well. I think it's so good for people to know this isn't just us making this stuff up and, you know, talking about it, but here is, I guess we'll go to this. Okay, so if you check out this is the article. So lingual frenuloplasty with myofunctional therapy, and it's 348 consecutive cases where they compared the patient's symptoms before and after. So it's really this table that I think is amazing. So benefits attributed to lingual frenuloplasty with myofunctional therapy. This is the key, because it's about not just fixing the structure of the soft tissues, but getting that function restored. And these are all adults. I think over a certain age. These are not babies. So.
We had no articles on adults or even teenagers really before this. And so,
so this is really, I mean, it's groundbreaking for us in the field because it's the first thing that's published in the literature, and it's a level 3 case study, and it's really, or not case study, it's a case series, but it's the highest level of research that we really can get in dentistry, because you can't double blind to doing a frenectomy. You can't double blind someone to doing expansion. So it's really hard to get, you know, level 1 research. I think it's actually impossible with a lot of this stuff.
It'd be hard, or it's unethical. So this is like almost like a retrospective cohort study too. They took all the patients they treated and then looked back and see like what happened.
Yes, exactly. You know the terminology better than me. So, but if you take a look at this, so grinding of teeth, there's 40 people who reported that they had clenching and grinding improve. So 4 said it didn't improve. So not everybody had that to begin with, obviously. But if you look down to sleep quality, 195 said it improved, 50 said they didn't. Neck, shoulder, facial tension or pain, 117 improved. and then snoring 102 improved. And of course, this is subjective information too. It's collecting data from a patient reporting it, but we can still quantify and use subjective information really.
That's their reality.
Yeah, it's their reality. Yeah.
I feel like I sleep poorly. Oh my gosh, I'm sleeping so much better now. I have so much more energy and I'm so much alert. Oh, we shouldn't count that because that's subjective. We don't have like an Epworth sleepiness scale on them, so we don't know, you know what I mean? Or like we don't have a PSQ for a kid. So yeah, I know.
So I think the research is so important. And I think if all of us in the field understand and know, like, wow, there is more and more research, it's changing literally every day. More and more stuff is coming out. I mean, since 2012, 2011, a lot of the stuff Christian Guilleminault was talking about before he passed was all geared towards sleep apnea and myofunctional therapy. And how does the tongue and the breathing and the function in kids affect them with these sleep issues, and then how does that affect their jaw and dental development to affect them as adults with their airway. So it's really important to know this stuff and to understand it. This is another great, it's a small study, but I'll just explain it really quick and then we'll wrap things up. But I like this because it's only, again, from 2019. And I don't know, have you seen this one, Dr. Baxter?
Oh yeah.
Yeah, I love it. This was like, it was a game changer for me.
And they're basically saying it's the fascia is the key, and sometimes it has some muscle in it, sometimes it's just mucosa, and sometimes it has fascia, mucosa,
I think being able to describe this to hygienists and dentists who think, why would you cut into the muscle? Why would you need to laser through the muscle of the tongue? That sounds so deep and horrible. Like, why would you do that? Well, now we have a new understanding of how the frenum is actually structured. So in the first number one example, we always thought there's a layer of mucosa. That's that top layer, of the equivalent of skin in the mouth. And then underneath, that's the fascia. And all we have to do is release that and they're good to go. Well, now we have this new understanding that there's mucosa, fascia, and muscle, and it can all be different for different patients. So B, that B figure down in the bottom, that's the muscle underneath, and the frenum is only composed of the mucosa. In figure C, there's mucosa and fascia. And then in figure D, you can see where in some patients, that muscle tissue, the two heads of the genioglossus, get intertwined into the frenum itself, along with the fascia and mucosa. And this, to me, was like a huge light bulb moment when I realized this. And the only way we kind of have this now published in the literature, and now it's part of our conversation and understanding, is because somebody dissected a bunch of frenums on cadavers, which sounds gross, and they figured this out. So
I have on Friday, just like that, we had the muscle up in it. Once we got through the mucosa and the fascia, some muscle fibers got that. And then like below that was the normal part of the genioglossus you'd expect. But it was interesting. And I had another dentist that was there watching as we're going through this is the dentist herself. So we had a course. Anyway, it was just interesting to see like what was in there. And with the CO2 laser, you can see exactly what you're doing. I'll show a video if you want to see it.
Sure, we're getting all like nerding out on our lectures.
I just had it here. I'll show it just so you can see, because like with the fascia and stuff, it just like opens right up. I mean, it's crazy.
Yeah, go for it.
Let me pull it up here. You see that?
Yep, looks good.
Yeah, so this is with the CO2 laser. This is a light scalpel, but I mean, just hovers over it and just disappears.
That's amazing. And we can give Peter a plug here too. I always recommend the light scalpel.
Yeah, it just opens right up. And there's no bleeding typically, but we're basically dissecting every time we do it. There's the fascia pulling up, and it's literally 3 seconds. That's the genioglossus underneath, so we didn't touch that at all. But I mean, so it's not even a deep release. So lots of people think it has to be this deep release. It doesn't have to be. And then we do kids while they're awake too. Here's a child that was awake when we did it. You get all the fascia.
Yeah.
It just hovers over it, and then I get bit at the end here, but yeah, there you go. Normally I use a tooth chair so I don't get bit, but me see if I can find the final thing for the research. So here's the research. This is a.
And this is your research.
Yeah, so actually just got published in Clinical Pediatrics. Hello, where'd it go? Sorry. That was another article I wrote. This is an article. This is, you can find this one's open access, speech and feeding improvements in children after posterior tongue turnovers. That's from a couple years ago. But this is the one we're most excited about. So this one was a prospective cohort study. That means before we knew what was going to happen with these kids, we did the procedure. We signed them up, like had all the forms, IRB approval, everything, did the procedure, and then we just saw whatever's going to happen at 1 month and 1 week and 1 month. And so it's published in Clinical Pediatrics. I haven't updated the slides, haven't spoken anywhere with COVID. But I think it's published like in April maybe or May. Mm-hmm. And so 37 kids, all of them had significantly better speech, feeding, and sleep. So speech improved. 89% of the kids had better speech. 83% had better solid feeding, which before this article, people would say there's no connection whatsoever with solid feeding and tongue tie. And 83% also had better sleep at 1 week.
That's great.
That's 1 week, 1 month. But speech improvements, I mean, so many of them. But big for me was about 3/4 of the way down, speech delay. So out of 37 kids, 16 had speech delay. 8 of those 16 improved, but 13 overall improved. So that means that 5 improved that didn't even know their child had speech delay before. They're just like, they're talking more. Like, I didn't think he could talk more than he was already. So they just thought it was normal.
Yeah, it's amazing.
Yeah. Feeding improvements, I mean, like not choking or gagging on foods anymore, less picky eating. I mean, slow eating, like where they eat like a bird, they're grazing on food. Often that's issues as well as tongue tie. And then sleep, I mean, so much like on sleep, almost everything was significant. Less sleeping weird positions, less kicking, like the restless sleep. So here's data backing up what we're doing. This is prospective cohort studies. That's level 2 evidence.
I didn't realize that. Nice.
Yeah. And then we're trying to get this paper published. So Dr. Zaghi and I are putting this together on the PSQ. But so the PSQ is a pediatric sleep questionnaire. And so this one is using validated measures. This is, so 27 of the kids out of that 37 were old enough for the PSQ. I think it's like 30 something months maybe. You can administer it. But yeah, highly significant. So anything over 0.33, so a third of the questions, 7.5 out of 22, has been associated with OSA in children. But after like we did the tongue tie release on them and with myofunctional exercises, so they were like 3 years old, so we just gave them exercises to do as best they could. So it wasn't like true like a therapy program, but we gave them like standardized exercises. Baseline 0.48, so they're all at very high risk for OSA. 1 week after, lower risk. A month later, even lower risk for OSA. And so it was measurable, lasting. They have less daytime symptoms. I mean, it can make a big difference if it's done properly.
Yeah, so, I agree.
Anyway.
No, this is great. Thank you so much for sharing that too, because like I said, we don't want people to think, oh, this is just Sarah Hornsby and Richard Baxter just making stuff up.
No, it's peer-reviewed, published in Clinical Pediatrics, which is a pretty good journal, actually. So.
Yeah, no, that's super impressive. I didn't realize that you got level 2, research out there. So that's amazing.
Yeah.
Well, I think let's wrap things up, but I want you to give a plug for your course. So tell us about the Tongue Tied Academy, and then I'll give a little plug for MyoMentor, and we can just kind of get on with our day. I know you've got patients to see. So. No,
for sure. Basically, it was what I wish I knew when I was just getting started. And so it's tonguetiedacademy.com. So I'm enjoying the screen share thing. It's fun. I'll show you here.
Okay, so tell us the 2 levels, because this is, I want to make sure the hygienists and therapists get it, and then the dentists. So.
Yeah, so there's a version and then a full version, if you will. The only difference is that the full version, it costs more, and then it has, and there's a free preview, and you can check it out before you buy it. It has like how to do the procedure, has the virtual shadowing, and then the light version for therapists is less expensive. I don't know, it's $495. So it's $2,000 cheaper, but it goes through like everything you need to know, like all the modules you can see on here. And some people, I think, where's Sarah? There it is.
Yay.
There's Sarah's picture. We got that up.
Oh, you put my quote on there. Awesome.
Yeah. No, thank you for that. But yeah, it's like everything you need, like wherever you want to learn. Anyway, it's cool.
Good. So say the cost again.
So the Tongue Tied Academy is $24.95, which sounds like a lot. But if you look at like, you only have to treat a couple patients and then it already pays for itself.
Totally. At all pays for
and
itself.
it's 25 hours of like professionally produced video, and you get ADA approved CE credits. And so they're, yeah, you can submit that. In a lot of states now have gone to like only online, or like they'll accept at least this year and probably next year too, because all the conferences got canceled. You can get all your CE credits that way.
Wow.
So if you're interested.
Okay. Good
Yeah,
to
and then
know.
the light version I think is 13 hours and it's $4.95, but it doesn't have the treatment module or the virtual shadowing, but it has everything else: the background, the research, the case studies, which there's 60 of them. So,
and there's videos of you doing the procedures and all that.
Yeah, there's
awesome.
lots of stuff in there.
Yeah, so I did the full version. I thought it was really, really great and well put together. I think it took me maybe 2.5, 3 weeks, only because like I'm, got busy stuff going on and stuff. But how long do you think it takes most people to complete that?
Yeah, so I think a lot of people, it takes them about a month probably just to kind of get through it. So like for me, like getting through Dr. Zoggy's course, which is similar material, I would like do it while I was running on the treadmill. So I joke like, oh, Dr. Zoggy, you're my running buddy. Because I would watch it like an hour at a time. And so if you watch an hour at a time, it would take you, about a month. Like if you watch it on your lunch break or something, which.
No, I remember, talking with you on the phone and saying like, you're like, I'm finishing up your MyoMentor. I'm listening to the discussion calls while I'm like working out or driving. I can't remember what you were doing.
I watched MyoMentor while running too. Yeah. So that's the best time to get stuff done. I mean, you can watch like a movie on Netflix where you can like learn something. So
good advice.
Hook up your phone or your computer to the TV. Apple TV, you can just like cast it basically. And,
totally. There's so many ways to do it, and you can multitask. So if anyone's interested in MyoMentor, I'll follow your lead and I'll share my screen here. What I'm doing is a 12-week course. Let me see here. It's for people who are new to myofunctional therapy, or maybe they've taken courses and they've got experience. The next one starts on September 12th. So this is a 12-week program. It has specific start dates, which is a little different from your stuff, Dr. Baxter. But what you can watch a little video of me talking about it. But I really focus on the concept of it's mentoring, it's guiding, it's hand-holding. And I also offer an online internship where you can work with one of my patients. I have a really cool community that I've developed with all the students who've gone through my program. We all kind of have this Facebook group, and I do monthly webinar Q&A calls every month for graduates. There's lots of ongoing learning. So the program's broken up into 3 modules. Module 1 focuses on symptom identification, so how to look at your patient and know that they need therapy or they have these issues. Module 2 is all about the treatment. So this is the exercises, the program itself. How to treat a patient. And then module 3 is practice management. So this is about like how to charge, dealing with insurance if you're going to. If you are a hygienist who's actually setting up a business, I go into that. If you're a hygienist and dental team who's integrating this into a practice, I go over a lot of that stuff too. So this is the pricing. It's $2,500 if you sign up for one person. So if you sign up like groups, I do have discounts. So 2 people signing up together, it's a little cheaper. 3 people signing up together, a little bit less. And then, if there's a dental practice, I always work out arrangements for like groups. So
that's like what we did. I think, the 4 of us took it.
Yeah, I think that's pretty good. Let me get off the screen share. But I loved your course. I know you've said good things about my course too. So that's one of the reasons we wanted to talk today. But I think we're good. And I know we're right at like the cutoff time. So any last words you want to share? Oh, you're frozen.
Because if anyone's listening, can you
hear
me?
Go. Yeah, start again because it just froze.
Okay, so I'll make a coupon code. So if anyone is interested, we'll call it Sarah, SARAH. And it's good for like, $250 off the Tongue-Tied Academy, the full version. And then I'll try to make another one, like Sarah Light, maybe, LITE, for the light version. Then that'll give you like $100 off the light version. So
cool. Maybe I should do that too.
Savings. Yeah, right? You can make a coupon code.
I'll do that too. I'll come with coupon codes. I'll call it Richard.
Oh, okay.
If anybody sees this.
There you go.
Anybody from, your audience, your followers who sees it and who gets in touch with me and they want a discount, or anybody who follows me, if they use the discount Richard, email me.
There you go.
Say, I saw your lecture with Richard Baxter, or your little I guess, what do we call this? It's just kind of a hangout session.
Phone call. Yep.
If you see this, I'll give people 10% off. So
yeah.
that's about $250.
Yeah, same thing. All right, we'll do $250 off for Sarah, and if you get the MyoMentor course, Richard, $250 off too.
Awesome.
There you go.
All right. Well, thank you so much for doing this. It's been super fun. I love talking with you. You're my new BFF from hanging out at conferences in the American Laser Study Club.
Yeah, it was fun.
Yeah.
Right before COVID, it was like February, like it was crazy.
I know. That was, I feel like that was like the last time that I got to do like a big group thing that was really fun. And so I have really fond memories looking back to that course in, where was it, Miami?
Yeah, Delray Beach. Yeah,
Delray Beach.
Yeah.
And that's where we got to hang out and see so many friends. And now I'm like, I miss those days. And that was, you're right, that was February.
I know. They're having another one in Vegas, I think, in March, the American Laser Study Club. Or no, it's February, sorry. It's like right before or after Valentine's weekend.
Okay.
So I'm hoping that'll still be live. We'll see. We'll see who knows what the future holds.
Yeah.
But yeah, that'd be fun.
Okay. Well, thank you again. I guess we'll just wrap it up and I'll talk to you later.
Yeah, sounds good. See everyone on YouTube land.
Bye.
Bye. Thanks, Sarah.